Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
All right, now let's look at treatment. And this is part 3. And this is the last part for anxiety disorders. And this will be the way the videos are going to go from here. I'm looking at psychological disorders. 3 parts: description, theoretical perspective, and treatment. So let's begin now this chapter, or this video, with treatment. And we'll start with psychodynamic approaches. Now, each theoretical approach or perspective here is connected with methods of treating anxiety disorders. They encourage people to face the sources of their anxiety rather than avoid them. So when we look at the more traditional psychoanalysis, it helps people work through unconscious conflicts that are thought to underlie anxiety disorders. More modern psychodynamic approaches also focus on the current disturbed relationships and encourage clients to assume more adaptive behavior patterns. And so that becomes really important in terms of looking at underlying barriers perhaps, and then looking to give alternative solutions to cope with those anxiety-based disorders. The humanistic theorists, they suggest that our anxieties result from the social representation of our true inner selves. Anxiety stems from incongruence between the true inner self and the presenting social self. So humanistic therapies aim to get in touch with our more genuine self, to know, to accept, and be our authentic self. That by not being the authentic self, we might be putting undue pressure on ourselves to perform based on how everybody wants us to be, and therein lies some of what might be tapping into more anxiety. Now, the biological perspective have spawned the development of varying drugs to treat anxiety. Now, biological is often medication-based. Antidepressants have had an effect on anxiety in addition to depression by normalizing the activity of neurotransmitters in the brain. More recent success with serotonin and with norepinephrine reuptake inhibitor, or the SNRI. Now, obsessive compulsive disorder responds better to selective serotonin reuptake inhibitors, or SSRIs, as it assists with serotonin transmissions, which is possibly responsible for the development of OCD. Now, drug therapy is not a one-size-fits-all, and often will do better in conjunction with cognitive therapies. So something that can control the biological persistence of certain things that might produce anxiety disorders, along with the cognitive rethinking, cognitive errors to correct thinking. Cognitive and behavior-based approaches will start with learning-based approaches. Learning-based approaches encompass a broad range of behavioral and cognitive behavioral techniques to help people overcome anxiety-related problems. Exposure methods help people with phobias overcome fears through gradual exposure to phobic stimuli. So I think I have an image back here that looks at, having a phobic response to spiders. You don't present a spider in front of the person to begin. You do more gradual, from maybe pictures through to being able to handle a spider. That would be gradual techniques. Exposure methods help people with phobias overcome fears through gradual exposures of the stimuli. The cognitive restructuring helps clients pinpoint self-defeating thoughts and substitutive rational alternatives. It's one of the things, the hallmarks of cognitive therapy, is it's replacing bad thinking with better thinking. Obsessive compulsive disorders is often treated with a combination of exposure and response prevention. Relaxation training is often used to help people with generalized anxiety to learn skills of self-relaxation. Behavioral treatment of PTSD incorporates progressive exposure to trauma-related cues and training in stress management skills such as self-relaxation. Now, a lot of that involves not just the behavioral component, but the thinking or cognitive approach as well. Cognitive approaches such as rational emotive therapy and cognitive therapy, they help people identify and correct cognitive errors that give rise or maintain anxiety disorders. Cognitive behavioral approaches to treatment of panic disorder help people with a proneness to panic disorder learn to cope more effectively with cardiovascular and other bodily sensations, to not overreact to palpitations and respiration changes, to recognize the environment, what's going on around them, and change the thinking that supports I must panic. Behavioral treatments of social anxiety can include gradual exposure, less to more stressful social situations until the urge to escape subsides. Therapist guides the clients at first, and then the client learns to self-talk with more rational and healthier responses. With agoraphobia, behavior treatments will often utilize gradual exposure and has had good and enduring success. Behavioral treatment of obsessive-compulsive disorder, again, there's the use of the gradual exposure and response prevention. Expression of effort to physically prevent a compulsive behavior from reoccurring is repeated and has minimized the anxiety associated with OCD. Now, this takes a lot of work, because you're asking somebody who has otherwise had impulses they can't seem to manage and compulsion that they can't stop but have to keep going. You're taking a while to get to where you can re-establish your thinking. Cognitive behavior treatment of generalized anxiety, relaxation techniques, and substitution, or that is the substitution of adaptive thoughts from the intrusive, anxiety-inducing ones into something more relaxing and decatastrophizing. Strategies to avoid thinking the worst. And so a lot of the cognitive and behavioral are doing things and repeating thinking that allows you to be more successful and gain some skills that will enable you to live a more normal life and have the thinking that you might imagine other people have. So that's the short review of treatment. And again, I will repeat, this is the way that most of the classifications for psychological disorders will go. All right, everybody. Good luck, keep up the good work, and we'll see you in the following weeks. Bye now.